Hello. I'm so grateful for those who came before me. I've stood on the shoulders of people most of my patients probably have never even heard of, and one of them opened a clinic doing this work in 1919 before the Nazis tried to erase it. I'm Dr. Dave, your transgender health and hormone specialist, and I've been doing this for over 30 years. Let's talk about him. His name was Magnus Hirschfeld. He was a German Jew physician born in 1868, and he became one of the earliest major doctors to study sexuality and gender as part of a natural human variation instead of treating them as shame or a disease. In 1897, Hirschfeld helped found the Scientific Humanitarian Committee, one of the first organized movements for homosexual rights. Their motto was Per Scientiam ad Justiam, through science to justice. That phrase mattered. Hirschfeld believed that if people understood the science of human difference, cruelty would have less room to hide. He spent decades fighting paragraph 175, the German law that criminalized sexual relations between men. Then in 1910, he published Die Transvestiten. Now, I want to be careful with that word. Today, transvestite is outdated and often offensive, but in Hirschfeld's time, he was using it as a broad medical term for people whose gender expression or identity did not match what society expected from the sex assigned at birth. In other words, he was trying to create language for people medicine had barely even acknowledged existed. And then on July 6, 1919, he opened Institut für Sexualwissenschaft, the Institute for Sexual Science in Berlin. This was not some tiny fringe office. It offered medical care, counseling, sex education, research, professional training, and community support. It had a major library and an archive. Staff and patients lived and worked there. People came from around the world for training and treatment. And this is the part people really need to hear and remember. It was one of the earliest places in recorded medical history where gender affirming surgical care was developed. Dora Richter, who worked at the Institute, was among the first known people to receive that care. Lily Elba, whose story many people know from the movie The Danish Girl, came from that same medical world. That was a century ago. Counseling, medical support, research care, research, community, all under one roof. It's like my dream. We did not invent this care yesterday. We inherited it. And then came May 6, 1933. Nazi students and supporters stormed the Institute, looted it, and seized its records, books, and files. 4 days later, on May 10th, many of those materials were burned in Berlin's public book burning of Opernplatz, now Bebelplatz. Those fires did not just burn books, they burned patient histories, medical research, queer history, trans history, evidence. For years, people believed Dora Richter may have been killed in the Nazi attack. Newer archival work now suggests she survived, thankfully, and lived as Dora and died in 1966. Even her survival had to be recovered from the ashes. Hirschfeld was out of Germany when the Institute was destroyed. He never was able to go home. He died in exile in France in 1935 on his birthday. And this is why history matters. When someone says transgender care is new, experimental, or a modern trend, they're simply not telling the truth. It might be because they simply don't know the truth. They are telling you what the fire was meant to make you believe. The work is old. The erasure of that work is what keeps repeating. We need to know our history. They counted on us not having it. I hope you enjoyed this as much as I enjoyed bringing it to you. I appreciate all of your support. It always gives me a warm and fuzzy feeling in my tummy. Please hit those buttons. Boop, boop, boop. Cost you nothing, and they sure help spread the word. If you don't mind, we'll talk soon. And remember to love, support, and protect each other. If you made it all the way to the end, if you know, you know. Meow, meow.